So hi, my name is Latia Wade Hickerson. I am a 2007 graduate. My major was health education and behavior with a specialty in community health, and I graduated from the College of Health and Human Performance. So some of the job titles that I've had since I've been in healthcare and health sciences, they've varied. And so I've worked as a registered nurse. I've worked as a nurse practitioner with a specialty in women's health. I've worked as a college professor for a nursing university. And I would also kind of give some unofficial titles of kind of being like a health coach, and one who also works in like public health and program development. I see some other areas there. Patient advocate. I would say that I've kind of worked in those capacities. So I would say that the point in which I realized my career path or goals probably occurred somewhere within my sophomore year. So I came here thinking like, since I was 9, that I wanted to be an OBGYN, and I got here and it's like, ooh, these sciences are interesting. Like, I'm not really seeing the full picture of why I need all of this. So at some point, like I said, around my sophomore year, I thought maybe I need to kind of pivot into nursing. So around that time, I started tweaking my classes to make sure that I could be a good candidate for nursing. And there was a lot of overlap with the classes I'd already taken. But the nursing program was really competitive, and so while I met all the qualifications to get in, there just weren't enough slots for me to get into the program, and so I didn't get into nursing here. So I had a decision to make at that point. I could transfer to another university and go to nursing school, or I could finish out the pathway that I had at UF, and that's what I decided to do. I didn't want to start over somewhere else. And I found health education and behavior, and I think that that was very predestined, because it really opened up my eyes to just this love for community health and education, and the patient advocacy that I talked about, and really teaching populations. And so I went that route and went to nursing school later, but I also went back and got a master's in public health. Like, that public health, community health component is a really rich aspect of what I do. And it's really been fruitful. So while at the time it was kind of life-shattering that it didn't go the way I wanted it to, I think it truly happened the way it was supposed to, and I was able to really come across a whole career and industry that wasn't necessarily on my radar before that. So the skills that I think are really important for success in healthcare, in the healthcare industry and health sciences. First, communication. I think communication is just key across the board. We have to be able to effectively communicate our intentions or communicate with other people in order to be successful. But an area that I think is often overlooked with that communication has to do with just our own self-reflection, and making sure that we are taking the time to be aware of who we are and the things that influence us as individuals. This is an area that we see, or we call them implicit biases, or just kind of tendencies or thoughts that we have that can show up in our line of work that could be damaging, and we may not even know that we have them. And so that's an area that I think is really important, to make sure that you have some kind of plan in place to be self-reflective, to make sure that you're able to show up as your best for your patients and for yourself. Some other skills and that I think are important would probably be having that spirit of inquiry, like I mentioned before, because healthcare and health sciences are so ever-changing. You need to make sure that you're up to date on what you need to do and how you can be a competent practitioner or provider, or whatever role in which you find yourself. And I would say teamwork, being able to be to work well with teams, because healthcare and health sciences are not isolated. You're always going to be working with other people, and so having those interprofessional skills to be able to engage with anyone are going to be really, really important to master. And that's a wonderful opportunity to practice that now when you're at UF, when you have those group projects that don't necessarily make sense in the moment. It's a really practical way of building those skills. So for students that may be unsure about whether or not they want to enter into the healthcare industry or health sciences, my best piece of advice would be to try to shadow. That was something that was really impactful for me as a high school student. I sought out opportunities to shadow and engage with people that were doing the things that I thought I may be interested in. And being able to see that in real life is helpful, because I think a lot of times we have an idea of what we think a certain job or industry or career entails, but it's not until you actually see the nitty-gritty of what happens that you're like, oh, okay, I don't actually want to do that, or I really love this. So if you can find opportunities to shadow or reach out to someone that's in that particular capacity or role, I think it'd be really helpful. A lot of times, practitioners, providers, nurses, healthcare administrators, whatever the specialty or area is, they like to hear from students. And so you can reach out and just say, hey, I'm a student, I would love an opportunity to shadow, to get a better idea of what you do. And you might find that people are very engaging and willing to help you in that process. And that modeling is really important. It's really key for you to be able to know. And it's okay if you don't know after that one encounter, but it's a step in the right direction to see if it's for sure something you might be interested in doing.